Good evening and welcome to the University of Michigan School of Public Health Graduate Information Session. My name is Mary Beth Carroll and I'm the Assistant Director of Student Affairs. As we begin the formal presentation, you'll want to draw your attention to the presentation slides as you can see here. My camera will be turned off during this portion of the presentation. Today's session is going to be primarily geared towards our online MPH program in Population and Health Sciences. At this time, we're currently seeking U.S. citizens and permanent residents who are looking for a 100% online learning experience with world-renowned faculty of the University of Michigan School of Public Health. This webinar will include information about the field, program design, and admissions. Also joining us this evening is Lisa Garber, Academic Program Manager, who you can see logged in. We also have two current students joining us, and they're going to be sharing information about their experience throughout the presentation. At this time, I'll let them introduce themselves.
Thanks, Mary Beth. So hi, as Mary Beth said, my name is Lisa Garber. I use she, her pronouns, and I work very closely with our students to make sure that they succeed throughout their program.
Hi, I'm Bono. I'm a current student here. I went to Penn State and now I'm at U of M, so that's a big deal.
I'm Kathy. I'm also a current student. I graduated with my bachelor's in public health from Eastern Michigan University, going to school for full-time and working full-time as well in the field.
Wonderful. Thank you.
Awesome. Well, thank you both for joining us. As I mentioned, both of our current students will be sharing their experience throughout the presentation, so we certainly look forward to hearing about that. Great. Well, as we get started, let's dive in here. Our first slide addresses what is public health. Public health is defined as the science and art of preventing disease, prolonging life, and promoting physical health and efficiency through organized community efforts. Public health is all around us. It's the air we breathe, it's the flu shot you get at the pharmacy, it's the ethics of genetic testing, and it's the creation of policies that govern healthcare. If you hear about something in the news, it's likely that there is a public health angle to it. So here is the common denominator. Everything we do in public health is about improving the health of people at a population level. At Michigan Public Health, we're pursuing a healthier, more equitable world through education, research, and action. As noted on this slide, there's no specific undergraduate degree or set of professional work experience required. We truly have students from all different types of backgrounds. There are endless career opportunities within the field of public health, and you're bound to find your niche. In addition to that, we have many support services in place to help our students find full-time employment after they graduate. This next slide here talks a little bit about our numbers, and it allows you to get to know a little bit more about Michigan Public Health. As you can see, there are 1,300 current public health students. This includes graduate residential and online students, and we even have undergraduate degree students as well. As a graduate of the University of Michigan, you become part of one of the world's largest alumni networks. At present, we have 32 current online students, and just think this could be you starting next fall 2020. We're accepting applications right now. This means great opportunities for networking with peers, and as you can see, a huge alumni base.
So our first cohort includes 32 students with a wide range of backgrounds and experiences, and as you can see, a sampling specific to professional experience right here. Now, with our first students just starting this past fall, we can't tell you where they'll go from here, but you can see our school-wide data on where our graduates go. This program draws a unique and dynamic group. Students have been logging in from as nearby as Ann Arbor and as far as San Diego. For some, this will be their first graduate degree, and for others, this will be one of many. Some are joining us right out of college, some are serving in the military, some are also students in other programs, and some hold senior positions in their fields. All are busy doing other things aside from this degree program. This past semester alone, our students have been changing jobs, traveling across the country and the globe, having babies, raising children, caring for aging parents, relocating, preparing for major career changes, and even taking lovely vacations. They've logged into class and advising from their commutes, from work, from airport lounges and Ubers, and sometimes even from the comfort of their own homes. Most importantly, they're adding class to their already full and busy lives, and they're making it work. That's the beauty of going online. So Kathy and Bono, can you weigh in and tell us how fitting it all in works for you?
I mentioned that I work full-time, not always traditional hours though, so it's a little bit challenging when I don't work a traditional 9 to 5, finding a sort of standard schedule for myself, but the great part about this program is, like Lisa said, you can really do the work anytime and anywhere. We still have the live Zoom session lectures throughout the week, but your coursework can be completed anywhere, so it really is flexible.
And Bono, what about you?
I'm in a similar situation. I was a scientist in Pennsylvania, and then I moved to Michigan, and I'm a pharmaceutical technician. My hours can be 7 to 3 or 5 to 5. So finding time to do my work can be difficult, but I get to choose when I do my work. So it's been really nice. There are days that whenever I would fly back to Pennsylvania where I'd be in the airport doing schoolwork or in a live session with my classmates.
That's awesome. Thanks to both of you.
Thank you. So when we developed the Population and Health Sciences curriculum, we wanted to offer the best cutting edge knowledge from our faculty's research and cover all of the foundational material required for an accredited MPH, and to keep the time to degree under 2 years. During your first 2 semesters, you'll complete 8 courses, that's just 4 per semester, that cover the core accreditation competencies. You'll typically take 1 to 2 classes at a time, requiring about 15 hours of work per week. Through your first 2 semesters of core courses, you will gain fluency in foundational principles and application of research methods, and be prepared to move on to advanced study, electives, and your capstone projects. As you can see here, these courses mostly run over 4 to 6 weeks and are stacked back to back. So this allows you to limit your focus and move on with rapid succession rather than dividing your attention across all 4 courses, plus work, plus home life for the entire duration of the semester. So once you've built a foundation with our core curriculum, you can begin to pursue a variety of elective tracks, which are bundled in 11 credit series. As you progress through a series, you'll be diving deep into your top 1 or 2 areas of interest, which lets you tailor your degree in a way that's totally unique to you. This format that you see here continues throughout the duration of the program. So you'll spend semesters 3, 4, and 5 taking electives. You'll also complete your applied practice experience and capstone projects, which give you a chance to put your education to work in real-world settings. In total, this degree requires 42 credits, and 19 of those are electives. So Bono and Kathy, can we call on you again and have you tell us about some of the favorite classes that you've taken or instructors so far?
Sure. So I think it really depends on the subjects that you're interested in, the style of learning that you prefer as well. Some of the classes have exams. Some of them are more project-based classes. So I think my favorites so far have been social determinants of health and nutrition and public health. But one thing that I really value about all the classes is that we're learning new skills, but we're given the opportunity to apply those skills to research interests that we want to learn more about. So it's learning new skills, but in a way that's really useful for you now and in your future career interests as well.
I agree with Kathy. My 2 favorite were Epi and Nutrition. Epi, I knew I was gonna like nutrition. I was totally shocked that I liked that class. But the professors are also just so nice and so willing to help. They're constantly telling us, like, if we need anything, just to contact them. So it's a very friendly online environment.
Thanks, Bono. So do you feel like you've had good access to your faculty instructors?
Extremely. I email them and they respond so quick.
Wonderful. Thank you so much. All of these classes that we're talking about here, including those dedicated to your applied practice experience and capstone projects, take place on the Coursera platform. They are 100% online, and there's no requirement that you come to campus. Although when you're close to us, we love if you visit. So when you log on to Coursera, you will find everything you need to complete a course. That includes video recordings that our faculty have prepared for you, readings, assignments, and links to weekly interactive class sessions through Zoom, which is the very platform that we're on right now, plus discussion forums for you to connect with faculty and your peers. We really aim to put all of these resources at your fingertips so you can access them anytime, anywhere. You just need to plan out your work in a way that lets you meet key deadlines and come to class prepared each week. Kathy and Bono, one more time, we're going to pull you in on the day-to-day of accessing this program. Can you weigh in on how you access class and resources?
Well, I usually just do it through my laptop. because it's just easier to move around. There are times where I use my phone, but that's, I don't know. I have a kind of issues with my phone sometimes, but I think it's just 'cause I have an older phone.
For the Zoom sessions live, I usually use a desktop just because that has the best like audio microphone option. And I've listened to the lecture recordings and done some assignments on my phone as well. So a little bit of everything, really.
Do you guys feel like it's been pretty easy to get access to like the U of M library resources that you need to complete your papers? How does that work?
I've been using those resources since before classes started.
Wonderful.
I like just reading those articles. But no, it's been really useful, especially for our one class that we have right now. I've been using those a lot for finding articles.
Fantastic. So what we're talking about, guys, is that all U of M students have access to our virtual libraries and our librarians. And so you can actually log on as a U of M student and have access to the wonderful journals that are normally behind paywalls for the traditional user. And we have librarians dedicated to public health students who help us dive through some of those articles and get access to what we need. So that's been very, very helpful for a lot of our students.
At this point, we hope that you can envision yourself as one of our current students, such as Kathy or Bono. We'll also hear from them in just a couple minutes. But for right now, let's take a turn and dive a little bit into the application process. You can also review this information online on our website, so please feel free to check that out. In addition to that, as admission staff, we definitely recognize that this process can be a little bit overwhelming. So please don't hesitate to contact us throughout any point in the application process. We are here to help answer any questions that you might have. So we utilize SOPHAS, which is the Common Application for Schools of Public Health. That application opened on November 1st. And as you can see, we have our priority deadline coming up in a couple weeks on February 15th. We encourage applicants to submit before then to be considered for the most scholarships and financial aid. In addition to that, we do have a hard application deadline coming up on May 1st. And as you can see noted there, classes begin actually before Labor Day this year. So save the date for that. Looking ahead to our next slide, we talk a little bit more about those application requirements. All of these requirements are required, and you have to submit them again through SOPHAS, which is the Common Application for Schools of Public Health. All of these application materials are going to be considered in our holistic review process. Our statement of purpose is really a longer essay where we want you to address questions such as why Michigan Public Health? We want you to talk about your future goals and aspirations. And faculty really want to hear your voice and your passion come through in this piece. Our second requirement in terms of writing is our reflective essay. And within this, we want to know specifically what characteristics or experiences you have that can contribute to our community. In addition to that, if you have any areas of concern in your application, if you have a lower GPA or you feel as though you don't have enough experience, this is where we want you to address that. Additionally, we require 3 letters of recommendation. We recognize that you may be a little bit far removed from attending a higher education institution. So with that, we really want you to select those who can speak to you having, integrity, ethics, and being successful academically in a rigorous program, really. Also, a standardized test is required. The GRE or the MCAT is noted. In addition to that, this year we added a fee waiver possibility. We're going to put some information in regards to that in the chat box, but if you have a terminal professional degree or professional experience, or you feel as though you have rigorous quantitative coursework, that may deem you eligible for a waiver, and we have a whole process that you can go through to get that waived. And you can also feel free to email our admissions team at sph.inquiries to get more information about that. So again, what I was speaking to a little bit ago was about that holistic review process. There isn't one thing that's going to make or break your application. It's the total package. We also have a prompt on our website that speaks to the holistic review process. This process ensures that no single factor leads to either accepting or excluding students for admission. In addition to that, this slide here demonstrates a little bit about some of the different experiences that we will be looking at when we look at your application. Our last slide here talks about financial considerations, and we encourage all of our students to complete the FAFSA form. Also, as mentioned earlier, we have our priority deadline coming up February 15th, and we want your application to be complete by then so that you can be considered for those merit scholarships. As you can see noted here, we award about $4 million in aid each year. And one thing that is really important in this process that I want to note is that your SOPHAS application actually serves as your application for the merit scholarships. So there's nothing that you need to submit in addition to be considered for those. Really, again, it's just making sure that all of those application materials that I just talked about are submitted so that your application can move on to the faculty review around that priority deadline again. Obviously, when you're submitting application materials, it can be a little bit stressful, especially using a third-party vendor, and sometimes the processing is out of our hands. So know that if you feel like your application might be getting stuck at one point or something, you can always call our team and we can take a look. In addition to that, SOPHAS has a great online service that can kind of help provide some customer service, and we can help definitely point you in the right direction if you have questions in regards to that. So again, the theme really, don't hesitate to reach out if you have questions. We're here to help you through the process.
I wonder, Kathy and Bono, if you could chime in here for a moment and tell us a little bit of advice that you would have for any students who are going through the application and admissions process right now.
I think that the admissions process was pretty much what you would expect going into grad school. There wasn't anything that really caught me off guard. I would say start your SOPHAS application as early as possible because there are a lot of pieces to put together and you want to make sure that you're being really thoughtful about your statements and essays and who you're asking for referrals, those kinds of things. But it wasn't as intimidating as it might feel going into it. The School of Public Health is really helpful about answering questions, and the SOPHAS application has a chat or email feature that I used quite a bit to get the SOPHAS specific questions answered, and they were really helpful as well. So you'll have all the help that you need.
Yeah, I agree. Like they were very helpful with everything, but it's just make sure you're turning everything on time and that you're giving your recommendations enough time to actually write those recommendations for you.
One question that I have for both of you would be, what's one thing that you wish you would have known prior to starting the application process?
I wasn't aware that the SOPHAS, this was a pleasant surprise, but I wasn't aware that the SOPHAS application actually served as your application for the merit scholarships at U of M. And I was able to get a scholarship that way. So I was really grateful that I didn't have to go through all of that extra work applying for additional scholarships to get the aid that I needed. So while that was a pleasant surprise, that would have been nice to know going into it.
I agree with that. But I think the other thing was I was having issues with my transcripts. So I kind of wish that I would have contacted them earlier than I had, because then I would have been a lot less stressed out for a couple of weeks.
I'll add, my name changed a few months before I started school. And I had a little bit of trouble with my transcripts because some were in my old name and some were in my new last name. So I ended up having to get my name changed on some of them.
That's a good point. So we have a couple of questions in our chat box here. So one, I'll pitch to you, Mary Beth, first, but Bono and Kathy, don't go away. So the first one is, can an international student study for this program? So
yeah, so at this time, as I noted at the beginning, we are only taking U.S. citizens and permanent residents who are looking for a 100% online program, but again, still having that University of Michigan name associated with it, same faculty, same academic rigor. So if you are interested in pursuing one of our degree programs and you're an international student, please don't hesitate to reach out to us at SPH Inquiries. We're happy to include you on a list about future opportunities that might be available to international students online.
Thanks, Mary Beth. And then the next one we have for Kathy and Bono here is, what led you to study this topic and what do you expect to do once you graduate?
Well, I got a phone call from Dr. Cardia, and talking to her is what really made me choose population health sciences, because I was actually accepted into the epidemiology residence program at U of M, and that was going to be what I was going to do. But then talking to Dr. Cardia, I just changed my mind. I was like, no, that's not what I want to do. The online program definitely is going to fit me more, and is just more like flexible, I guess.
What do you expect to do next?
I hope to work for the CDC. That's my biggest goal.
Wonderful, wonderful.
I had my bachelor's degree in public health. So going into graduate studies, I already knew that that was my passion, but I chose this program because I really wanted to keep working full time while I was in school, but still have that opportunity to interact with campus when I wanted to and have the connection with the group of students and with the faculty. And that's been my experience so far. So I'm very happy with my choice.
Oh, thanks, guys. Terrific. We'll just keep on moving through the chat box at this point now. So next up on the list is, can you tell us a little bit more about the professional experience necessary for the GRE waiver?
Yeah, so in terms of that, we are looking for those who are able to, again, demonstrate professional experience outside of the classroom. And there's a waiver process that you need to go through. And for that, we ask that students submit transcripts. There's a small prompt in regards to why they might be eligible for the waiver. So that's where you'd want to include your professional experience. At this point, we're looking for, a few years out. And also those who are able to demonstrate strong quantitative ability, because again, we want to ensure that you're going to be successful in the program. And there are some rigorous courses associated with having a strong quantitative ability. So that's kind of a brief overview of the pieces that we're looking for. Once we get all of that from an applicant, we send that off to a smaller review committee, and you'll hear back from the team within 2 to 4 weeks in regards to whether or not that's been approved. And again, that's for the GRE or the MCAT, and that is a requirement. But like I said, this past year we implemented a waiver process for that.
Thanks, Mary Beth. We have a couple questions here about expected jobs after graduation and what students go on to do.
Yeah, so one of the great things about being part of this program, again, is you're part of the Michigan public health community, even though you aren't necessarily based here residentially in Ann Arbor. Our team is very equipped in terms of staff. We have quite a robust careers team here at the School of Public Health, dedicated professionals who assist students with internship placement, full-time job placement, job shadowing, you name it. So they are doing different programming events. They're helping students prepare for interviews. Also, as a current student, you have access to Career Connection, which is an online database that, again, has all of those types of opportunities available to you, no matter where you're at as a student. We pride ourselves on helping our students find full-time employment. Some of our more recent top hiring sectors include academia, consulting, private industry, hospital or healthcare providers. And those are really just to name a few. If you go on our website and you look at our career outcomes, you can see some that are more based towards our residential. With the new online program, obviously we're working towards those types of materials for this audience, but know that our students are going to have the same types of opportunities, and those are just some good examples to kind of get you started depending on where you envision your future. But know that if you come here, again, you have access to the same great, wonderful resources and support services that any other student has.
So we have a couple other questions on here. We've got about 3 minutes to get through them, so we'll see what we can do here. So one very quick one here is that we expect to admit another 30 to 60 students in the coming cohort. So the current cohort, as we mentioned earlier, was 32, and we're looking to grow that cohort now that we have our pilot year under us. And we are now accepting applications, and we'll begin to offer admissions decisions after the committee is able to review this first wave. So after the priority deadline of February 15, we'll start making decisions. So it's a great time to get your application in, but we will certainly be considering applications all the way through the May 1st deadline. We have a couple questions about a way to follow up and talk more after this call. We absolutely can put you in touch with some of our current student ambassadors. And if you would email us at sph.inquiries@umich.edu, which is displayed on the screen right now, we can put you in touch with some wonderful individuals, either our current students here, if they are willing and able, or any of our admissions ambassadors that participate with us as well. So we absolutely want to keep in touch with you and make sure that you get connected with our current students. You can also visit the stories portion of our website, which is our We Are Michigan Public Health series, which features profiles on a wonderful range of students here at Michigan Public Health. So they include our online MPH students, some of our faculty, and students throughout all of our residential programs.
I see a question here in regards to GRE scores. There's not a minimum when it comes to the GRE or MCAT or the GPA piece. So know that, typically we are having prospective students aim for at least the 50th percentile. But again, that's just the average. We certainly accept students above and below that threshold. And above all, if you take anything away from this, know that, again, it's a holistic review process. So the standardized test is one piece of the total package and the total picture that we're looking at. So I recognize that it can be a little bit overwhelming, but, prepare adequately and take the exam, and know that we also get applicants that take it multiple times, and that's okay too. So if you're taking it and you're not exactly getting the score that you want, please feel free to reach out to us.
And then this just in, I see, can you provide examples of the practicum for online students? I'd be delighted to. That's something we're very excited about for this group. So students will work with practitioners in the field. Michigan Public Health has a wide network of partners who work with us for applied practice experience and internships and all sorts of opportunities for students. And our students will actually enroll in a class which is led by Dr. Cardia and Dr. August, and they will walk you through step by step what you need to do to apply what you've learned to a real world problem in the field. And that's what we call the applied practice experience. So you'll partner up with one of our practitioners and produce a product that helps solve one of their needs. So an example of this might be a video abstract that outlines the research that they're doing, or a fact sheet on a top problem that they need to communicate to the community. So there's a wide variety of products that you could produce, and it depends a lot on the practitioner that you're interested in working with and the skills and competencies that you really want to hone and demonstrate by producing that product and adding it to your e-portfolio.
Well, we are just about getting to our ending time here today. We appreciate all of you jumping in to learn more about the online program.
Please do stay connected with us. After this meeting, I will be sending a follow-up. Feel free to email us at sbh.inquiries@umich.edu at any time to get connected with us. I would be happy to meet with you individually to answer your questions more in depth, or to talk more specifically about any of the areas that may have not been answered today.
And as a reminder, our priority deadline is coming up on February 15th, and we encourage you to have your application complete by then so that you can be considered for the most scholarships and financial aid. And as one of our current students added, please note that your SOPHAS application will serve as your application for scholarship consideration.
Thank you all so much. Have a great evening.